Let me, on behalf of Investec, welcome all of our good clients to this Medicare webinar. We're pleased that you're able to participate and hope this is an informative and useful presentation for you. We found with our experience that healthcare and healthcare costs are a significant element in most retirees' lives. And Medicare, as most of you know, is the primary insurance, healthcare insurance for people over the age of 65. We're very proud and pleased that we've discovered a Medicare expert who will be joining us for this presentation. Joanne Giardini Russell is the founder and owner of Giardini Medicare. She'll describe in a little bit more detail what her firm does, but I think it's fair to say she's a Medicare nerd and will be happy to answer questions. If you look at the bottom of your screen, you may have to wiggle your mouse or touch your screen a little bit. There is a chat function just basically under my nose. And if you have questions during the presentation, please write them in. My co-host, Margarita Barcenas, will be handling the questions on behalf of everybody. If we need to unmute you to get clarification, we'll do that at that time. Another housekeeping item, the slides will become available to you after the presentation. We'll email those to you along with contact information for Joanne and her firm. And she's promised to allow us to send a brand new workbook that they've developed to help people think through their options with Medicare. During the presentation itself, you'll all be put on mute to avoid any background information, any background noise. But you can communicate with us via the chat function at the bottom of your screen. And if you've got any questions, let us know. There is I guess we're ready to go. I was gonna say there's a gallery view and a speaker view, but I believe Daniel will be spotlighting Joanne's screen so that you'll be able to see her presentation in the full width of your computer or your phone or your tablet. With that, Joanne, can we turn it over to you?
Absolutely. Thank you. Thanks everyone for tuning in too, because Medicare can sometimes not be exciting. So, Dan, I'm just going to share my screen, right?
Yeah, give me 1 second. Let me mute everyone and then I'll unmute you.
Okay.
So give me 1 second. Okay, you should be good to go.
Am I unmuted?
Yes, you are.
Okay, terrific. And you can see my slides?
Yes, I can.
Okay, thank you. Thanks. So again, thanks for tuning in. I am, as Doug mentioned, we have an agency. We're here in Michigan. So just FYI, we're a virtual agency, but we're in Michigan. We work in Texas and a whole bunch of states across the country, about 45 states. And some of the things I'm going to be a little generic, if you will, about Medicare. This is not easy to be location specific. So there might be something you hear thinking, well, that's not the way my plan might work. So a lot of carriers, you know, have different rules. There's different areas of the country, all sorts of things that I can't get into the weeds. If we did, we'd be here for 6 hours tonight. Okay. So again, I'm just going to kind of run through a process. A lot of times just walking through this, it does bring to light things that are, you know, people are confused about. Medicare is just a huge area of confusion. I had no idea 5 years ago how complex it was until it was, long story, but basically my eyes were opened. That's all we do today. So we do have 5 of us that are just 24/7 Medicare. It's a family agency. My adult kids are involved. We find it fun, which is really strange. But anyway, hopefully you learned something. Please, like they said, just put in your questions in the chat. I'll address anything. And if there's extra questions, I'm happy to email those. We try and be very accessible with our answers for things too. So here we go. I'm going to hopefully advance my slides. Okay, this is our launching pad with Medicare. We talk about how confusing it is, and this is somebody that's newly 65, or even these days, if you're 63 almost, this stuff starts hitting you. It hits your mailbox. There's seminar invites. There's all sorts of material floating around there. This is all products. You know, products are thrown at you. It is Medicare sales, essentially. So this is where we find the confusion starts. We'll get the phone call from a 64-and-a-half-year-old, like, oh my gosh, my mailbox and the solicitations, agent phone calls, things like that. So this is not how we operate. We kind of do the opposite. We don't do postcards. We don't do mailers. We work with great firms like Investec. We want to partner with people that have great clients and they want to understand what they're doing. They want to learn. So we really focus on the education of Medicare. That's why I spend a lot of time doing these types of things and writing articles and just answering questions and things like that. Some people think you can just go to get Medicare help online, and you can. You absolutely can. And a great source is Medicare.gov. It has a ton of information in it. It's very technical. People don't tend to like going there for information. But what we find too, the hardest part of Medicare is you don't know what to type into that search bar. You get there and where do you start, right? What questions do you know to ask? A lot of times people don't know the question to ask. So we can kind of guide you to some of those things. But Medicare.gov is a fantastic site and a source of information. There are places that are not great sources of information. And this was a piece last year from Costco. And we took issue with it only because millions and millions of people read this Costco magazine. This article was a great title, Get the Medicare Thing Right. This is how important it is in retirement. Couldn't agree more. However, it's written by a doctor who's an MD. Doctors, I will tell you, know nothing about Medicare. So that was one of the problems, but those two red arrows on the side are technically incorrect. So the fact that millions of people read this article over a weekend, they talked to their friend on Saturday, they affirm, of course it's right because my friend said it and the Costco magazine said it, and it's written by a doctor, so it has to be right. It's wrong and it's misleading and it can cause people to make some serious mistakes. So it's just, there's so much of that out there. So where we really specialize is the whole transition to the Medicare system. This can be somebody at age 65 that's brand new to Medicare and needs to sign up. This could be somebody who is 68 and just retiring. I have a 74-year-old psychiatrist the other day that just retired. It doesn't matter when they're new to Medicare, but we kind of can help them bridge that journey across because it is confusing. You've been in group insurance typically for 40 years, or maybe you bought your own insurance for the last 5 years, things like that. Those situations are easy because you were just presented 1 or 2 plans a year and you just signed up. And if you didn't like it, worst case, you just get a new plan next year, right? Medicare is not like that. There's a lot of decisions. People get very stressed with the entire process. So that's really where we excel. We're not a great agency for someone with a 92-year-old mother that they just want to save $50 a month in premiums. That's just not what we do well. So you'll see some of the hand holding we do as we go through this. So how we work with people is pretty basic in some ways. It's, what is Medicare? We'll walk through that. Do I need to get it? The answer is you don't have to, but you might want to. Maybe you should, maybe you shouldn't. That's the assessment when you're 65. How do you go get it? That's a big thing when somebody just says, go sign up for Medicare. What do I do? Where do I go? Do I go online? Do I go in an office? Things like that. How much is it going to cost? We spent a lot of time discussing the cost of Medicare. What is it going to cover? We'll get into some of that. How do you put all of those things together? And what do those choices look like? And really at the end of this, we really want people just to understand what they bought, understand how it works, not have any issues with it, and go relax, go retire. So what is Medicare? Medicare is simply health insurance offered by the US government. I think because it's the government offering, it makes people a little extra nervous, but honestly, if you start thinking of it like Aetna or Blue Cross or United Healthcare, it's an insurance option. People are eligible for Medicare when they turn 65 years old. If they're disabled after 24 months, they're awarded Medicare. Or if they're diagnosed with end-stage renal disease or ALS, they are given Medicare as well. Tonight, we're just going to concentrate on 65 plus, just the most common situations. But again, the key word is eligible. So just because you're eligible for this Medicare thing doesn't mean you need to go do it or have to go do it or even should go do it. So we'll walk through some of those situations in a little bit. It is comprised of 2 parts. There's Part A of Medicare and there's Part B. When we talk about Part A and Part B, just be aware that this is called Original Medicare. Some people call it Traditional Medicare. We refer to it as Original Medicare. So part of Original Medicare is this Part A. What it is the room and board component of Medicare. So it covers hospitalization. If you're hospitalized overnight, it covers skilled nursing facilities. It'll cover hospice, some home health care services. There is a deductible, $1,408 this year, and there's coinsurance, days 61 through 90, and then coinsurance after that. Most people on different Medicare plans that you pair up with Original Medicare won't experience a lot of these copays because they put a product in place. What we do, we are agents. At the end of the day, we are agents or brokers where we take a product from a carrier and we put it in here so that people don't experience these copays and coinsurance things. So we bring it up, but we don't have people struggling with those payments because they have a product that they've purchased to handle some of those things. So I'll talk about that a little bit too. One of the key things here that I always want to bring up is that this does not cover long-term care expenses. I think many people look at the word skilled nursing and they assume that means nursing home, and it does not. It does not cover a 3-year Alzheimer's stay. It will not cover any of those types of things. This is designed for health insurance. This is if you need skilled nursing to rehab from a knee replacement, for example, and go stay in a facility for 18 days. That's what it's designed for. It doesn't cover custodial care. Custodial care is, light housekeeping, transportation, helping with different services that people can't do that are not home health. So it's a different area completely. Those are out-of-pocket costs. This is something you're going to want to talk to your advisors about. If you're going to potentially need those things, and a lot of people do down the road, this is where you come back to your advisor and you talk through how to have those dollars available for those expenses. Just do not rely on Medicare to cover those. So Medicare Part B is the rest of Medicare. And when I mean the rest of Medicare, this is what we're used to. This is doctors, x-rays, chemotherapy, broken bones, wellness business, all those things that are outpatient surgeries, things like that. So this is the part that does come with a cost. And this is the part that gives people the most trouble. This is the part that people get wrong the most, the timing of when to pull the trigger to get Medicare or do not get Medicare. Medicare Part B will pay 80% of your healthcare coverage. It's not designed for 100%. So you are responsible for the 20%. So Medicare will pay 80%. You will pay the rest. They have an annual deductible this year of $198. Again, being brokers, we come in and solve this 20% whole so that people don't have to pay that. But people without any other product in just A and B of Medicare, I had a woman last year who had a knee replacement with Original Medicare, and she said she had $12,000 in bills from a knee replacement. So it is also, there is no limit to how much you can pay. There is no cap. We're all used to, a deductible or a max out of pocket. There is no max out of pocket for what Medicare, the 20%. So you could be in for some hefty bills if you don't plug that hole with something. Pointing out HSAs, a lot of people do have HSAs these days. You can use your HSA funds to pay for Part B premiums and Part D premiums. A lot of people don't realize you can reimburse yourself for Part B premiums. At the end of the year, you just send a reimbursement into your HSA, and you can do that. Original Medicare does not cover these areas. A lot of people are surprised that when they arrive that there's no dental. This is, again, Original Medicare A and B. There's no dental coverage, no fillings, no cleanings, no root canals, no implants, no nothing. There's no vision exams. This is not cataracts or glaucoma things. That's the medical portion. So those are covered. This is just a classic eye exam. Going into Costco and getting glasses, something like that is not covered. Hearing, traditionally, most hearing episodes, unless it's medically connected, will not be covered. There are no gym memberships with Original Medicare, and there is no prescription coverage with Original Medicare. When people turn 65, this is really common confusion. Everybody assumes, and they are told, and their friend told them, and their sister told them, and everybody told them that they have to go sign up for Medicare Part A at least. It's not true. So prior to letting you all into this room, we were talking about a client that the firm is working with that is in the situation, turning 65, is contributing to a health savings account, is still working, has a large employer plan, and probably wants to contribute to the HSA. Should that person enroll into Medicare Part A? No, they should not. So if you enroll into Part A or Part B of Medicare, you are not allowed to contribute to a health savings account any longer. So that is one reason why somebody would not want to sign up for Part A. If that person that we were talking about were not contributing to the HSA and everything else was fine, I would say by all means, just go enroll in Medicare Part A. It's free, go ahead and do it, gives you a little more coverage. Okay, but this is just to try and negate that. There's so many people that just assume that you have to go do something. Another thing people think here is that when you're turning 65, if you don't want either part of Medicare or Part B or something, a lot of people tend to say like, well, I have to go tell Social Security I don't want it. And you do not. You do not need to notify them at all. The only time you would want to tell Social Security office that you don't want Medicare Part B is if you were collecting Social Security maybe at age 63, now you're 65, you are going to be automatically enrolled into A and B of Medicare. If you do not want Part B, you need to flip the card over and follow the instructions to give it back and just say, hey, I don't need it right now. As long as you have qualified health coverage elsewhere, you don't need to have Part B at 65. That, I will say, is a huge area too that people make mistakes. A lot of people unwillingly will just get the card, put it in a drawer. The money's coming right out of their Social Security net deposit. They don't even notice it happening. 3 years later, they'll tell us they insist they don't have Part B, and we ask them to get their card out, and well, what do you know? It's stamped A and B, and they've been paying for 3 years. They've overpaid. They've just caused themselves more trouble. They're limiting their plan choice down the road, and they had no idea they did it. Okay, so just take everything you hear kind of with a grain of salt. This piece comes from Social Security Administration, who we all think we should be able to trust, but it's for Medicare information. Social Security office does not do anything with Medicare other than enroll people and collect premiums. That's it. People get consistently poor advice from the Social Security Administration regarding Medicare. They are not the people to ask. This piece that comes out, this person highlighted the heck out of it and sent it to me, and he said, see, I do have to sign up. He was on a large group plan. He did not need to sign up. But it reads, if you don't sign up for Medicare Part B when you're first eligible, your coverage may not start right away, and you may have to pay a late enrollment penalty for as long as you have it. Those are true words. So when we talk about us being this Medicare geeky kind of nerd stuff, we have to be with those words. So yes, you may have to pay a penalty. He did not. In his case, he was totally fine. So he was not going to be penalized. A lot of people get scared into signing up for Medicare, and they don't need to be, but just buy this little box here, So I think some of these people even bring this to your office to show you. So where people go for advice, we kind of touched on this. They go to their friends. We joke that, they're on Friday nights having, well, the old days before COVID, they were having cocktail parties talking about their Medicare plans, and they're all one-upping themselves. Like, well, mine's free and I get this and I have a gym membership, and it's just the funniest thing to hear. They're just comparing notes, and that's fine. Just take the notes and then run it by somebody that knows about Medicare. Social Security Administration, we talked about that. Just don't rely on them for advice. Your doctor, we touched on that as well. Doctors just don't know Medicare. If you call the doctor's office, sometimes the billing office will tell you that the plan, what plans they take, that doesn't mean they're great plans for you. It just means that's the ones your doctors choose to take for financial reasons. That's how they get paid and billed. So you got to be really careful with that. And lastly, the financial advisors, the CPAs and stuff, they're not spending 12 hours a day doing Medicare. I don't think they want to be. That's why we pair up with a lot of these firms, because it's very specialized, and it's just mind-blowing sometimes how hard it is sometimes to navigate. And we occasionally get stumped, and we spend, like I said, 12 hours a day, 7 days a week pretty much here. It's crazy. So this is kind of our normal phone conversation with the person. You're eligible for Medicare. You're calling us because you're 64 and a half. Okay. If you're retiring, are you eligible for retiree coverage? A lot of places still, or I should say some places still have retiree coverage, not a lot. But if you do, a lot of times the retiree plans are very, very, very solid. So we really don't often recommend people get out of retiree plans. Sometimes there are reasons if they're very expensive. They are, I will say, getting a little worse every year. It seems like, the teacher plans, even the big three in our area, and Ford Motor and the big three, they have a really, really solid hourly unionized plan that's phenomenal. So those folks just stay in the retiree plan, and we don't even work with them. However, we'll have like a Ford executive that doesn't have a retiree option, and those are the people we would be helping. Let's say they have a health reimbursement account and they need to get a Medicare product. So those are our people. But if you've got a retiree plan, think long and hard about leaving those, because they're generally pretty solid. Are you actively employed? Just because you're 64 and a half and turning 65 does not mean you're retiring at 65. You might tell us that, well, no, I'm going to work till I'm 70. Okay. So if you're actively working and you are in a group plan and you like it, I would say this is all pretty generic, but if you like the plan, you're happy with your coverage, your health is pretty good if you're not using the coverage a lot. All coverage is great if you're not using it, right? So if you're healthy and pretty well not using it, or a couple times a year, and you're not paying very much. A lot of people will say, well, I'm paying $100 a paycheck twice a month. It's only $200 a month for that person. That's inexpensive. So we're going to say to that person, well, if you're not contributing to the HSA, just stay on the group plan and call us when you need us. They may come back at 68 or 72. We find so many people have plans. Like last year, we talked to a whole bunch of people that told us they were going to retire in 3 years. Well, then COVID hit. We've had a ton of just, instant retirees, whether it's hospitals and doctors and things like that. A lot of nurses are just getting out. So again, if you're actively employed, just stay on your group plan. There's no reason to jump out to Medicare at that point. The other thing is, if you're actively employed, do compare what your costs are to Medicare. So if you have an employer where they're only paying 40% of your premiums and you're paying $600 a month, that's a whole different story. To me, the benchmark's about $300 per person. If you find that you're paying over $300, and this is for most people on the base level rate of Medicare, then I would definitely start looking at Medicare as an option. And you can always leave a group plan. Very infrequently will the group plan say, no, you have to stay on the group plan. They can write it in there, but they really don't want to have you on the group plan. And it's because of your age. Okay, so they would prefer typically that you're not on the group plan. So let's say you have a small employer, you work for a CPA firm, and there's only 6 people in the office. That's a situation where most of the time you need to go get Medicare because it is primary to the group plan. Once in a while, a group plan will contend and stay primary to Medicare, but you just need to be sure that you have that verified and it's in writing. And if that's the case, then that's fine. And you don't have to get Medicare. But generically, most of the US, under 20, you have to go get Medicare hooked up. And when I say primary to Medicare, so what'll happen is with that small employer situation, if somebody has a knee replacement in a small employer where the group plan now becomes secondary, if they bill Medicare and that person doesn't sign up for Medicare, there's no coverage. So technically that group plan can say, well, no, we're going to pay 20%. Nobody's paying 80%, but the client, the consumer. Okay, so it is a big deal. So always verify those under 20 situations. If you have ACA or marketplace coverage, whether you have a subsidy or not, doesn't matter. You need to go do Medicare. Some people, if you're paying $50 a month because you have a fabulous subsidy, they don't like Medicare necessarily because their costs are going to go up. However, you've got people that are paying $1,600 a month, maybe as a standalone business owner, and they love Medicare because they're going to greatly reduce their cash flow and they're going to have much better coverage potentially. Last situation is COBRA. With COVID, we are seeing so many COBRA issues, and this one just kind of makes us crazy because to me, they're very unavoidable. If HR, group people, whomever, as a group, would just hand somebody their documents, if they're over 65 years old, they have to go get Medicare Part A and Part B. Had a horrible situation that we're working through right now. A guy was, after 35 years, he ended career at 70 years old. He was given 4 days to prepare. He's on COBRA. His wife had chemo 5 days later. While he's on COBRA, they did not have Medicare. Nobody told him they need Medicare. So we got it backdated to June 1st. Had he not bumped into us, they had a $13,000 COBRA bill, a chemo bill, that technically the COBRA carrier can pay 20% and he's on the hook for the 80%. Biggest problem is a lot of times the COBRA carriers they won't even start poking around and auditing a claim till the dollars add up. And at that point, maybe you're at $150,000 of bills. Then they're going to poke around, and then they're going to come back a year later and say, oh, well, you should have had Medicare and you didn't. That's where the real problem happens. When you catch it fast, you're okay. But down the road, we had somebody we heard that was retro billed 2 years prior where they should have had Medicare and did not. And they'll balance bill you. And then it's just your bill. And at the end of the day, it's hard because HR, all they have to do, again, just I want you to remember that 65 plus and COBRA don't go together really well at all. Okay, so when then we go through all of this with somebody and then they say, well, okay, it points you to Medicare. You need Medicare and a product with an agency like us. Then we go into, well, how much does it cost? A lot of people think it's free or highly subsidized, and it's not. So this is our income thresholds. So Medicare is based on your modified adjusted gross tax return. What they do for this year, 2020, they look back to 2018, they pull your tax return, they say, oh, you're at $250,000 on a joint return, you're gonna pay $289.20 per person per month. Questions usually pop up here with, well, I retired, I'm not making $250,000 anymore. I'm gonna live off $100,000. So that's not fair. And you're right, that's not fair. So what we do is we help people go request a redetermination of this number. We help them sign a form that basically says, I was working, my work has stopped, I don't make this money anymore, my tax return going forward for the next year is projected to be $100,000, and they will grant that appeal, and they will reduce that down to $144.60 for the person. We help with appeals all the time. They work just about all the time. If you're gonna just retire and have great asset wealth and you're living off of $250 for the rest of your life, that's not appealable. But if it's a change, it's a life-changing event, okay? Once in a while too, we can kind of coach people through if they kind of goofed up and pulled something out of an IRA or something, or sold something, a piece of property, we can kind of structure a story that honestly will typically work, and it will get appeals processed as well. So it's always worth trying to appeal, like I said, unless it's a blatant no way. You're gonna be living on $500,000 for the rest of your life, then don't be happy and don't appeal anything. So there's also a surcharge on Part D as in drugs. So this affects all people with higher net worth. It's a tax, it's a surcharge, we can call it whatever we want. If we get it appealed downward, it'll also be reflected on the Part D side, so you don't have to worry about that. Once we get, again, okay, so now you understand that you need it, you understand how much it costs. Now it's like, well, how do I go get it? This is the way we get it. There's 3 enrollment periods for Medicare. There's an initial window that people have, there's a special election period people have, and then there's a general enrollment period. This is the initial window, and everybody seems to know this because they all kind of panic with that. Oh my gosh, I got to do 3 months before my birth month. But they'll call, it's funny because people at 68 will call and say, hey, I know I got to do something 3 months before my birthday. No, this happens one time, and it only happens when you're 65 years old. So as you approach age 65, this is a 7-month window. It doesn't return again. So you have the ability, because you're eligible for Medicare, you have the ability to sign up if you need it or want it. It starts 3 months before your birth month, your current month of your birth month, and then 3 months after your birth month. And then once it's gone, it's gone. If you don't need any piece of Medicare, or you want to get Part A, whatever, you can do whatever you want within this window, and then you bypass that. The next time you typically come back is something called a special election window. This is for people typically leaving the group insurance place. So they're coming out of their workplace, large employer, they come in, they're like, I'm retiring September, I need coverage October 1st, I'm 68 years old. Okay, so what we do is we help them time when their coverage will start, and we will give them the forms. So when we talk about the penalties, this is what people worry about. You sure I'm not going to get penalized? I am positive. So if you're at a large employer, you did not get Part B, you're now 68 and you're going to retire, we give you the forms. It's called an L564. And what that is you take that to your employer, HR signs off just saying John has been in the workplace since age 65. He's had coverage with us. They take that form, they give it to Social Security. That is the proof that he didn't need Medicare. That is why you do not get penalized. It's actually kind of logical when you just kind of, put these things together. So at that point, you're applying for Part B at age 68. You're showing proof that you didn't need Medicare. That's why you didn't have it. We started October 1st, and then we give them the ancillary coverage that they might need. The last window is that GEP that I'm not even going to talk about. It doesn't affect many people, but it basically means that if you missed your initial window and you missed a SEP window here, you are deferred to the GEP window, but it doesn't happen often, so we're going to skip that. So the Medicare New Handbook, back to, again, the Medicare site is great. The Medicare New Handbook is great. It's long. A lot of people don't read it. We do. It's really, it is full of really good information. There's an app actually you can put on your phone that goes along with this for coverage, things like that. It's really pretty nice. When people are starting Medicare, this is one of the biggest things we try and get them to understand. So you have original Medicare, but now you have two choices and two paths of coverage. Now, note here that this does not address retiree programs or things like that. And this is not VA coverage and different things like that. This is just the majority of America has two choices and two paths. And we just always want to make it very clear that you understand what the two are and how they work and what you're getting into when you're going down one of the two paths. So on the left-hand side, you have original Medicare, which we talked about was A and B, parts A and B. You will add a drug plan to part A and B. And because part A and B are going to cover 80% of your health insurance, you're going to add something called Medigap, or a Medicare supplement, but you look at the little green check mark, it's called Medigap in the book. We call it Medigap just to have some distinction so that people understand what we're talking about. But you have A and B, you add a drug plan, you add a Medigap plan. That Medigap plan simply follows Medicare, and it pays the 20% that Medicare doesn't pay. That's it. So Medicare covers the country, therefore Medigap covers the country. So you can go to any doctor in the country that takes Medicare. It's actually pretty simple. So it just, again, it follows Medicare. You never go to a doctor's office and say, hey, do you take Aetna? You say, do you take Medicare? Okay, on the flip side, path number 2, on the right-hand side is something called Medicare Advantage. Some people call it Part C of Medicare. However, this is a bundled approach to Medicare. So the person that signs up or enrolls into a Medicare Advantage plan is no longer enrolled in A and B. Technically, they are moved over to the Medicare Advantage plan that offers and runs the same services that A and B provide. The government pays the Medicare Advantage plans to manage your care. Whatever path you pick, you will still pay the Part B premium to the government. However, if it's Medicare Advantage, they're going to route that money plus more. It's about $1,000 a month that goes to the Medicare Advantage company to manage your care. So in exchange for signing up for that package, and it's typically, they can be zero. The plans can literally be zero. They will typically include your drug plan, so it's very convenient. You'll have one card that puts all those things together. They will often throw in some minor vision and dental services, and they are, for all those features and the convenience, they will manage your care. So you have to go along with their networks and their fee structures. You do have to call your doctor's office and say, do you take the United Healthcare plan? Do you take, and I know you've all probably seen headlines. United Healthcare in Texas has had some horrible things with leaving people stranded with, when they canceled contracts with certain hospitals down in your area. So you just have to know that that's what you're trading, things for. I'm going to run through a financial example, kind of just giving you the nuts and bolts, and it usually comes to life how these work differently than one another. So these are Michigan rates. So a little bit, kind of ignore the rates. So this is a Plan G. What a Plan G means, it's a Medigap plan that you have to pay the $198 Part B deductible. So therefore, once you pay that $198 for the year, that's your max out of pocket. So that becomes your whole cost. Everything after that is no charge, whether it's chemotherapy or physical therapy 20 times or skilled nursing for 86 days. Everything you do, hospitalization, everything is zero. So you also don't have dental. You go down to the bottom, you don't have dental, you don't have vision, and you do have to add a drug plan. And depending on how many drugs you take and what you take, they can be cheap or they can be costly, anything in between. On the right-hand side is Medicare Advantage. So this is just a popular plan in my backyard. It's $14 a month. Max out of pocket is $6,000. If you have chemotherapy, that's one of the unfortunately, cancer will blast these plans to the max out of pocket typically and very fast. So this person in this case would pay $6,000. But otherwise, on the way there, they would be paying $300 a day for hospitalization, emergency care. You can see physical therapy is 40%. Chemo is typically 20% copays, which is why it gets so expensive so fast. But you can see they put in some dental coverage, and they've got some vision coverage, and then on the bottom line, they include the drug plan. So you get all of that for the $14 a month. So it can be very attractive to many people. Here's what happens when people don't understand some of the more mechanical rules of Medicare. So when somebody is brand new to Medicare and they are getting their Part B for the first time ever, and let's use a 68-year-old in this case, that same 68-year-old person. He doesn't have a penalty. We're getting him all set up. He's brand new to Medicare. He's starting his Part B for the first time. When he starts Part B for the very first time, a person has 6 months from the start date of Part B where they can go get any Medigap policy that they choose, anything. So a great example is my Cobra case, she's having chemo. So I know she has chemo. She just started her Medigap, her Medicare Part B start date, July 1st. And I know she's ill. I know she's getting $13,000 sessions. I just said there's a 20% copay with Medicare Advantage plans. So she has to get Medigap. So anyway, she's sick. But in this case, she can go get Medigap for 6 months. She's protected from pre-existing conditions. If I didn't meet her, she went on a Medicare Advantage plan, came back 3 years later, she has a cancer, she is not going to get Medigap. So pre-existing conditions do come into play with Medicare. For 40 years, you've never dealt with pre-existing conditions, pretty much. No Obamacare. There's just so much misconception about this. Problem is too, when you don't understand, you have two choices. A lot of people will take the cheap route thinking that it can always get the Medigap later when they need it and kind of game the system. And I will just tell you, it just typically does not work. So just know that you've got this window here. And if it's a concern for you, you take advantage of the window. And if it's not a concern, it's fine. At least you understand that this is an offering and it's out there. You just need to understand how these things work. So after that, they can totally refuse to sell you any Medigap policy that they offer, and they can charge. Some cases, it's not even worth doing that, but it's a big deal. Medicare pre-existing conditions do come into play. Here's some common things we hear about Medigap, what they like, choice of doctors. You can go to Mayo Clinic, you can go to MD Anderson, you can go anywhere you want, travel within the US, budgeting, it's easy because it's a flat fee. You're pretty much relegated to your cost, and you got to be okay with the higher monthly premiums. Medicare Advantage, not everybody can afford Medicare. So there are people, and certainly pockets of people, that can't afford that. If that's the case, we try and maybe give them a cancer plan. So meaning what that would be is it's $20 a month. If they got cancer, God forbid, they're going to get a check for 10 grand from Aetna to help with your copays and things like that. VA system. So VA people don't even have to get Part B. We would recommend that you do. And then some of those people, we can give them a zero premium plan so they can actually come outside the VA, so which is nice. But I have a guy in Michigan that's 80-ish, and he never travels. He hates paying doctors. He's got money in the bank, but he doesn't want to pay anybody. So we have a zero premium plan. He pays zero to his primary care doctor, and he thinks he's kind of gaming the system. It's pretty funny. And he's got the money. If something happens to him, he has $5,000 to handle his max out of pocket. So I'm not too worried about him. So both places really do have their place. Our beef with the industry, though, is Medicare Advantage is more sold, and not enough people know about Medigap. So when I do all these talks, so many people will say, I've never heard of that stuff, never heard of that stuff. Well, the time you want to know is when you can pick, because I'd be an angry consumer if I came back 5 years later and nobody presented any of this stuff to me. So again, it's in the handbook. It's just people don't often take the time to go through that. When you get into medications, I'm not going to touch on medications a whole lot. The donut hole, the infamous donut hole, what that just means is you're paying a lot of dollars for medications. If you are healthy, you might be spending $200 a year on that, but you know, I've got some people that take drugs that are $1,300 a month is their copay because the drug was $250,000. That's not super common. What is pretty common, unfortunately, are the people, maybe type 1 diabetics that are $2,000 or $3,000 a year on insulin. Some of those things are really costly. Even Eliquis, Xarelto, those are drugs that when you're on group insurance, you're used to having a $10 or $15 coupon. You step over to Medicare and all of a sudden it's $80 a month and you're not understanding why. So Medicare does not negotiate with pharmaceutical companies, not allowed to. So therefore, they are the largest consumer of meds and they're not allowed to negotiate. So there's a lot of cost expended on medications. And I think it's one of the hardest things to plan for in retirement. I really do, because you never know what's going to happen. So I don't have an answer for you there. Part D plans, we give them to everybody. You don't technically have, if you get a Medigap plan, you don't technically have to get a Part D plan. However, if you don't, you're going to get penalized down the road for a late enrollment. And bigger than that, if you're that person that suddenly needed Xarelto, and if you're caught without a drug plan, Xarelto is going to be $5,000 a year. At least with the drug plan, it's $70 a month. So you can't always go get a drug plan when you want it, anytime during the year. So we always, always, always give a person a drug plan, always. Drug plans are based on zip code, what you take, what pharmacy you prefer. Nothing to do with pre-existing conditions. Every year, I should mention here too, every year you should shop your drug plan, unless you don't take any medications. If you take nothing, being on a low-cost plan, that's fine. If you take 2 or 5 or expensive meds, make sure you're shopping the drug plan annually, because they all change. In September, you're going to get your new annual notice of change. And then all of a sudden it's going to say, well, your drug changed tiers, or they dropped your formula, or, CVS is no longer about whatever the situation is. Make sure you know in September when you have the ability to change in October. Otherwise, what happens is people find out in February, it's too late. You're stuck for the whole year. Here's the timing of things, October 15th to December 7th. What we can do during that time zone is people that have a Medicare Advantage plan, that maybe something changed and they need to change the plan, they can change it. Starts a new plan January 1st. Drug plans, as I just mentioned, they should be shopped. A new plan starts January 1st. People that hear about Medigap maybe and decide to go that route after giving it some thought, they can leave Medicare Advantage plan. They can apply with underwriting to the Medigap carrier. If they're approved, they get a Medicare supplement, a Medigap plan effective January 1st, and a drug plan to go with it. January, February, and March is a newer disenrollment period we have, where we can now, in January, February, March, annually, we can take people out of Medicare Advantage again, and we can put them back to Medigap and a Part D drug plan. The rest of the year is off limits for anything other than new enrollees into Medicare Advantage. Medigap, however, if somebody has like an older Plan F and it's gotten pricier, things like that, Plan F is no longer sold to new Medicare folks. Let's say, so somebody wants to change carriers and they're still healthy enough to do so, they can do that anytime. That can be June 1st, July 1st, April, it doesn't matter. So those things can be changed just like an auto policy. They can be changed any day of the year. So just kind of remember that. Okay, so why we talk about Medicare is so important to talk about before you're 65. And it is, because you can alleviate a lot of problems. And these are some of the common, we talked about all these HSA contribution issues, do it, don't contribute, stop doing this, don't file, etc. Under 20, talked about that. Comparing your work insurance, pre-existing condition, you're protecting that. If you know somebody's ill, then by all means, that's a super important thing to pick the best product. Part B penalties don't happen very much. COBRA, constant, and not having long-term care solutions in place prior to the event that you need it. Here are some of our resources. So this is YouTube, as we mentioned. If you just search Giardini Medicare, this is a growing library of really good clips. There's one, Medigap Explained. You can see that one's even 28 minutes, and I'm spending 35 minutes, so I can't get into the weeds like he can in that 28-minute clip. Same with Medicare Advantage. There is one next to that, what is IRMA, the appeals process? How do you do that? How do you sign up for Medicare at age 65? It's a different process than when you're 68. There's a COBRA video. How does the Part B, the Part D deductibles work? There's a donut hole one that's really popular. So there's a whole bunch of things out there. And what we love is we can always just sort of answer a question sometimes with the video. Like I have people with the Cobra situation all the time, and they just say, well, I'm going to take Cobra and I'm 66. We send them the video, and next thing you know, they're on the calendar for an appointment because they're scared because they did the wrong, and they are doing the wrong thing. So it's really been really helpful. And you privacy your own home. You just kind of watch it, record your, write down your questions, and then call us if you'd like to. This is our new website. We literally launched the new website yesterday. So we're putting our resources back in terms of content. So bear with us there. But the Transition to Medicare Guide book on the left-hand side, that's what I'm going to provide the PDF to the group with, that they're welcome to, give that to you along with the copy of all these slides. So in the workbook, it's 37 pages long. Do not get overwhelmed with that, because some people aren't going to use 2 pages of it and some are going to use all 37. It's fillable PDF. And what it's designed to do is to teach you some of the Medicare stuff, but then you give you a place to kind of note what you're doing. So it's, your drug plan, what is your new drug plan showing? What does last year's show? Just so you can kind of keep organized, because that's the problem that people have, is they don't really know what they have. And I can't remember this, and I don't know what I did this. I don't know where am I paying this from? What am I really paying for Medicare? All that kind of stuff. So this guidebook is designed to teach you. There's a lot of content in it, but there's a lot of blank things that you can fill out if you want to. You certainly don't have to. So it's available to people. Like I said, I'll give the PDFs of those 2 items to people. We have a chat function. We have emails. We have all sorts of ways to communicate with us, links to the YouTube up there. It's constant. So this is another resource we have. It's just a vault of information that we created a while ago that a lot of the YouTube already talks about this, but these are some of the documents, maybe the form, for Social Security, life-changing event, things like that. So we have a whole bunch of ways we can route you to information, and that's it. It's a lot, but that's it.
That sounds great, Joanne. Thank you so much. I have a couple of questions lined up for you right now. The first one's coming from Susan Cooley. And Susan, we may have answered this for you. The question was, is the premium static, or can I call to get my premium lowered? I think we covered that.
Medicare? Is that Medicare premium or carrier premiums?
Susan, do you have an answer for that?
The Part B.
Okay, the Part B premium. So it'll stay, it is what it is unless you appeal that and get it reduced successfully. Does that answer your question?
What do you need to appeal it?
It depends on the situation. So if it's a sold building versus I'm not working anymore, there's it's an S44, the form, and you can go see the form online. It's a life event form that you check mark one of the boxes. Sometimes it's death of a spouse, work reduction, even hours reducing, things like that. So I would say, call us for a private conversation and we can kind of help you structure the appeal.
Great. The next question I have is, what do you recommend if your doctors do not accept Medicare?
Ooh, that's a tough one, because there are some direct primary care doctors that don't participate with any insurance, period. And then you're into private pay. So we haven't really hit that very often at all. Most of the world still takes Medicare, 97%. So if it's a doctor that 1 out of your 5 doctors doesn't participate, you're just going to have to deal with either getting a new doctor or continuing to pay out of pocket.
The next question we have is, at what age are we eligible for Medicare if we are not actively employed at age 65?
At age 65, period. Even if you're not working.
Okay. What do you recommend for medical expenses outside the U.S.?
Outside of the U.S., so the Medigap plans will come with $50,000 typically of emergency travel, which doesn't sound like a lot, and it would seem like we would hear issues about this, but we've never had an issue with anybody saying something's not covered, you're not handled, things like that. Medicare Advantage plans will have same thing, emergency coverage elsewhere. There's not always a limit, and they vary a lot more. The biggest thing to be concerned with, in my opinion, is the medical evacuation of travel. If you go even to Mexico and you have a heart attack and you are flown back to the US, that cost, we met a guy that happened to him. It was a $50,000 plane ride. That cost will not be covered by Medicare unless you're in the United States. So there's a great one called MedJet Assist that we really like for medical evacuation. You can get an annual membership, a trip per trip, things like that. Don't rely on Medicare to be to basically get you a Z-Pack if you need a sinus infection in Rome, something like that. It's not designed for that. It's for emergency only, and they'll get you back here and treat you. If you're going to Ecuador for 8 weeks, I would buy a short-term medical plan that would handle that country for 8 weeks.
Does that answer your question? Excellent. If I have BCBS as a secondary, is that Medigap?
Could be. Here in Michigan, Blue Cross Blue Shield has both Medigap and Medicare Advantage.
Okay.
But probably it's Medigap because it's a secondary.
That's
Now, the way to figure it out is if you're carrying 1 card or 3 cards. Do you show your Medicare card when you go to the doctor?
I show both.
Okay. Do you have a drug plan? Do you have a standalone drug plan as well?
It's part of the Blue Cross Blue Shield.
So you could have a Medicare Advantage plan. If it's a bundled package, again, if it's packaged together, that could be Medicare Advantage.
It's just whatever came with my retirement.
Okay, you're probably in a group Medicare Advantage plan. If it's a retirement plan, and those are typically very good plans.
And that is Medigap.
No, it's usually a group Medicare Advantage plan.
Okay.
Right. But the retiree ones, I want to point out too, they're negotiated differently. So they're not, the ones I show on my screen, or like I said, these are the ones that are just available for people that don't have access to retiree plans. Yours are different, probably because they're negotiated for retirees. So they're stronger, is what I mean. Better.
Susan, does that answer your question? I will take that as a yes.
That was a thumbs up.
I saw a thumb.
Okay. Okay. If I stay on my company plan until I retire, do I risk having an exclusion because I didn't buy my Medigap policy at age 65?
No, that's a great question, because what you're going to do is you're not going to get Part B at 65. You're going to cruise past that because you have your employer insurance that is over 20 people. And then you're going to have that. So you do not lose that open enrollment. You're deferring that open enrollment down the road. Then when you need it at age 67 or whenever you need it, that's when you come on, and then the spigot starts. And then that's when your open enrollment is protected for 6 months. That makes sense?
John, does that work for you?
What if it is under 20 people?
Yeah, what if it's under 20?
Then you'd have to go to be sure that your group plan will either stay primary, if they will. A lot of them do not. And if they do not, then you need to go get Medicare Part A and Part B. And then you do have a decision to make. Do you want to risk your open enrollment 6-month window? Not to say you can't get something called guarantee, this gets in the weeds, if you can get guarantee issue down the road. However, you limit your plan choice by taking guarantee issue. So it's a longer answer. But at that point, what a lot of people do is just say, well, forget it. I'll just get off the group plan. I'll just go get my Medigap now if it's important to you. But do clarify that your small group would or would not be primary to Medicare. That's a big one.
Can you compare plan networks under Medicare versus an Advantage plan?
No, because there are no networks with Medicare. Medicare is a national program. So your network is the nation. Most doctors, 97%, are taking it. Same with the hospitals. So that's your network. Where a Medicare Advantage plan is contractual. So they are just contracting with individual doctors and providers. And if you're not in that contracted relationship, then you can't go there because they won't let you. So there's no comparison. They're apples and oranges.
Good. I asked the question, and my experience is that there are a lot of doctors who are getting off the Medicare. They're not taking Medicare patients any longer. That's getting smaller and smaller.
Is that not taking new patients, new Medicare patients, or not Medicare period? To the entire practice? Because if they're not
That would be
accepting new Medicare patients, that's different.
New patients. So grandfathered patients are still taken, but
Okay.
new patients are not.
So they are still contracted with Medicare. They're just not choosing to take new Medicare patients in.
Yeah, but it's a big impact.
Oh,
A lot of people.
absolutely. Absolutely. And that's a doctor issue. And then there is a doctor shortage already. And holy smokes with COVID after this, my concern is in 10 years. Seriously, but that is a different issue. It's not that the doctor's not taking Medicare. It's just he's closed for business to new people.
Joanne,
Yes.
my experience is I'm also retired from the U.S. military, so I'm eligible for TRICARE for life.
Which is awesome.
And what I'm finding is in large cities, such as Houston, that have large medical centers, and New York, the doctors they have the market there that they don't need to take Medicare and they don't need to take TRICARE for life.
Wow.
And if you're in rural parts of the country, and I've talked to a lot of military people,
Yep.
and this is what we're kind of coming to. I don't have the data to show you this, but anecdotally, we're finding that if you're in New York, you're in LA, or you're in Houston, doctors are not widely accepting Medicare and or TRICARE for life. If you're in rural Texas, rural Tennessee, or in Florida, anywhere in Florida, they'll take it. That's just anecdotal information.
Which is great information. I've never heard that about TRICARE, but absolutely about Medicare and some of these conglomerates. That is the way it's going. And then you've even got carriers buying up the conglomerates and hiring the doctors and having the plans that they steer to the doctor's offices.
I have two family members that are doctors at the Mayo Clinic, and when I told them that my doctors in Houston have stopped taking Medicare,
Yep.
they were shocked.
Yep.
They couldn't begin to, they said, that's not possible. I said, well, yeah, let me give you the names of the doctors, call them up.
Yeah.
So,
And what you're mentioning about the rural, that is absolutely Medigap market because they don't have the big networks and the big hospital systems. So I agree with you. That's a healthcare thing. I did not know that it affected TRICARE also. That's super interesting. But Medicare, yes. And then you're relegated with what they all, in my opinion, what the government and everybody really wants is they want everybody in Medicare Advantage plans. Because it's funded by the government is offloading the risk. The carriers are making a whole bunch of money. So it's just that whole steerage. And maybe in 20 years, we all have Medicare Advantage for all. I don't think we're ever going to have Medicare for all, but Medicare Advantage for all wouldn't surprise me, unfortunately.
but if we follow the UK, United Kingdom, you'll have a two-tier system.
Yep.
You'll have the doctors who are most demand and they can charge any money and people will seek them
Sure.
out. And then you'll have the medical care for everyone else. That seems to be what's happening here.
I agree. I don't know that it'll happen for 20 years, but I do agree. That's the path. It's a very subtle path. Great info.
Okay, your next question is, if your company plan runs until the end of the year, should I wait to sign up for Medicare until it expires if that is within the 3-month sign-up period?
When's the birth month?
Mr. Harlan?
When do you turn 65? Is it September?
October.
October? So if you're October, and if you're October and you want to get off the group plan, you want to go Medicare and Medigap or Medicare Advantage, you can get out of a group plan at any time during the year because Medicare is a qualifying event to let you out of a group plan. Not that you have to do that, but if that's what you're electing to do, you can do it in October. You can do it anytime during your window. You could even do it next June. So you can, at that point, once you pass that 7 months also, you can get out of that anytime you want.
If I could jump in,
You
Larry.
can let the plan run to the end.
Larry, if I could jump in, this is Doug Garrison. The ExxonMobil
Yeah.
Medicare supplement plan will kick you into Medicare at the month in which you turn 65.
Okay, there you go.
You'll come off the retiree medical plan and go onto the Medicare supplement plan in October if that's your birth month.
So you don't have a choice. That happens automatically then.
They'll send you information to get you signed up for the Medicare supplement plan, and they will take you out of the ExxonMobil retiree plan. Medicare will become primary. The Medicare supplement plan will be secondary.
Okay.
There you go.
Thanks, Doug.
Joanne, that's all our questions that I've got for you.
We had a couple that came in a few days ago because you guys collected some, you had some people sending some in. So I'm going to read a couple of these. One is I turn 65 next month. I have signed up for Medicare A and B, got my card. I'm going to sign up for Plan G through Medicare plan that's my former company sent me. My question is about the Part D prescription drug plan. Do I have to sign up for Part D or can I sign up for it through ARP? Or do I sign up for both? This part is confusing. I don't want to get penalized. It's hard to answer that one just because I don't know if when she says the Medicare supplement plan that my former company sent me, that could be a retiree plan. If that happens to be a retiree plan, they will most often have the drug coverage included. So I'm not quite sure on the answer. Second question is if one is turning 65 and has full-time employment with good medical and dental benefits, is it recommended to sign up for Part A and B now or upon retirement? Absolutely upon retirement, not now. Just defer what you can defer. Unless you do Part A, not doing the HSA, but absolutely defer Part B. That's it.
Well, our time is up. It's been an hour. Thank you so much, Joanne Giardini. Russell, we appreciate very much the presentation, and we will be forwarding to every participant information about getting in contact with Joanne's firm, along with copies of the material, the presentation, and the workbook. Thank you all for participating. This is one more service that Investec likes to provide to its clients. We hope this has been useful. And we wish you all stay healthy and have a good weekend.
Thanks
Thank you. Take care.